name is Sharon Quinn. 3 years ago I was at the bedside taking care of patients every weekend in the ICU, and I was offered an opportunity with the IS department at the recommendation of Susan Grant and Jack Morford to work on the CPOE project and develop order sets for the future of our CPOE at Emory Healthcare. I transitioned over to this job and have been working on writing the orders and transferring paper order sets into electronic orders. During that time, we realized that nursing worked with the doctors to develop the orders, and we needed to get together design groups to figure out what the actual electronic orders were, because nursing and clerks for years had taken what was written on paper and put it into the computer, and often it required a decision as to what the correct order actually was rather than what the doctor had written. So design sessions were formed, and we put together interdisciplinary groups including lab, dietary, respiratory, radiology, physicians, bedside nurses, CNSs, anyone who had an impact on that patient care delivery. And in these meetings with these groups together, we were able to discuss why the orders needed to be written the way they were and what the correct order would be, educating both providers and all the ancillary departments in what was meant and what needed to be ordered.
Hi, my name is Marilyn Pierce, and I'm an Emory nurse, and I'm here to tell you more about our magnet journey. I worked with Sharon Quinn in the CPOE implementation, and after we had all of the orders created with our collegial and multidisciplinary groups, we then, as nurses and nursing as a whole, supported implementation of the CPOE at Emory Healthcare and all of our facilities. We did this by being part of a transitional team. There was a huge number of nurses who were available to ground and support the go-lives, as well as continued support as nurses at the bedside took the role of the ACE role, which would be to learn and support and be sort of a super user, and then talk with their peers and make sure their peers knew that they were a resource there at the bedside. So we supported the implementation, which lasted from February of '09 through September of '09 with nursing, as well as other groups. We had the other ancillary groups and physicians involved in implementation. So nursing was at the forefront of working in a collegial group for implementation. What I think is significant as well is the journey didn't stop there. We continue to support CPOE with nursing and other ancillary groups, as well as physicians. We have a continued T-team. We have an ACE network that learns and continues to support at the bedside. And what we found as well is that the journey is not ending. It is continuing. We continue to support future changes as upgrades occur, as new things come out, and as those who are using the tool find that they like it and can find ways for it to support best practice and better care and evidence-based practice. We will continue to support CPOE and the journey that we take toward giving our patients the best possible care at the bedside.
Magnet means me.
Magnet means me.